Hi, my name is Christina Johnson. I'm 37 years old and I have recently been diagnosed with Ehlers-Danlos syndrome, hypermobility form 3. I know there's no cure for the syndrome itself, but would love to hear about success and failure stories with other people that have been treating the symptoms of this disorder. Knowledge is power, and getting proper care is also important. I feel ready to share, and I've noticed that this illness, you notice who your true friends are. The ones that help you when you really need them. The ones that just kind of distance themselves when you're having bad days. Pretty much kick you when you're down. I've lost a few friends because my activities are limited and I'm not the fun person that I used to be. Sorry for my bird in the background. But, sorry if the bird in the background kind of threw me off. But I do feel ready to share. And I've had some new problems developing. And my family doctor really doesn't know that much about this condition. The specialty clinic where I was diagnosed in child serve, they've been really helpful with referring me to doctors that know about EDS. And I know with all the different doctors that I see, that with the collagen that's in my body being weak, they each have different band-aids or stitches, I'll call them, to kind of keep me together. My pain specialist does certain procedures, epidural, cardial injections. Physical therapist keeps me strengthened. My pain psychologist kind of gives me understanding. Urologist for problems that I've been having. My orthopedic is kind of trying to help me work on my knees. The pharmacist keeps all my medications together. And the cardiologist that keeps monitoring on my heart, because with Ehlers-Danlos syndrome, your heart is one of the things that can be affected. Here, you'll see my calendar for the month of April. And you will see that I had doctor and ER care or otherwise. You will also see on there my migraines. I'm trying to pull it up now. My headaches that I get quite a few of them. So hold on and I will show you. And there's my calendar. You'll see all the different reds and highlights. Those are the headaches and migraines, and where you see typing you might not be able to see it very well, but that is where I have doctors and physical therapy and different other appointments. Now sometimes on my very bad days, I'll show you what I will say are my band-aids, all my braces, past care, to use when different things happen, sometimes dislocations or sprains, and yes, whiplash happens. And I also have an electronic device, my TENS unit, and it puts pads on my back or my neck or different sprains where the muscles are tightened up. The TENS unit helps loosen them so I can have somewhat better days to help control my pain at home. So here is my TENS unit. It goes on the pocket or a belt and just gives little things. Then I have my knee braces, my neck brace, soft collar, and my cane. And vision's affected, so I have to have more regular routine vision exams, get new glasses, and then also, I take quite a few pills. I take some of them multiple times a day. My meds I am on are inhalers for COPD, asthma, medications for irritable bowel syndrome, nerve pain, anxiety, depression, migraines, sleep, acid reflux or GERD, and of course pain. But on pain medication, I'm really not on anything but an anti-inflammatory. And if you listen to me carefully, you will notice that I have mentioned Ehlers-Danlos, but no procedure or medication to take care of it. Why? That's because there is no medication or cure for Ehlers-Danlos. Only medications help limit the debilitating underlying symptoms. In fact, some of my diagnosed medical conditions fall under the Ehlers-Danlos related symptoms, but the doctors never picked up on it until just March of 2014. In the past, doctors telling me my hearing loss was just hearing loss, but it falls under Ehlers-Danlos. My migraines, my neck pain, chronic sinus trouble, TMJ, asthma. I have an inverted chest, or sunken chest, or what they call also a pectus excavatum. Curvature of the spine called scoliosis. Degenerative disc in the neck and back. Osteoarthritis in the knees, which cause pain. I also have dislocations often. Irritable bowel syndrome, depression, anxiety, eczema, acid reflux and GERD, chronic pain, COPD, obstructive sleep apnea. And these were all diagnosed, and then I got diagnosed with Ehlers-Danlos. Now I know you're all still wondering what Ehlers-Danlos is and why I'm raising awareness. Well, May is Ehlers-Danlos Awareness Month. And, my years were, not following through with doctor's cares for a long time. And only the last couple of years I've finally, got tired of putting up with the pain. And piece by piece, I painstakingly gathered the answers to this puzzle called Ehlers-Danlos. The right medications to treat symptoms, a helpful and compassionate team of doctors, each I put, pieced together in a puzzle. And which each piece of this in place, our understanding grows. I'm slowly getting a grip on this vicious thing that has attacked me, and I'm working hard to keep it under control. I will still need some ongoing therapy and face unavoidable challenges associated with Ehlers-Danlos. It is, after all, an incurable genetic condition. The neurological issues are being treated, not cured, and will likely always plague me. However, I now have hope for the future, whereas for much of the past several years, I've had precious little hope. And here is what EDS is. Ehlers-Danlos syndrome is the classical type is a connective tissue disorder characterized by skin hyperextendability, abnormal wound healing, and joint hypermobility. Includes two previously designated subtypes, EDS type 1 and EDS type 2, and now recognized to form a continuum of clinical findings. The skin is smooth, velvety to the touch, hyperelastic. An example, extends easily and snaps back after release. Unlike lax, redundant skin, it is just kind of bounces back. The skin is fragile as manifested by splitting of the dermis following relatively minor trauma, especially over pressure points, the knees, the elbows, the areas prone to trauma, your shins, your forehead, your chin. Wound healing is delayed. Stretching of scars after apparently successful primary wound healing is characteristic. Complications of joint hypermobility, such as dislocations of the shoulder, the patella, digits of hip, radius, clavicle, usually resolve spontaneously on easily managed by the affected individual. Other features include delayed motor development, fatigue, muscle cramps, easy bruising. Less common findings include mitral and triclosan valve prolapse, aortic root dilation, and spontaneous rupture of large arteries. Some of those would be classified under the vascular Ehlers-Danlos syndrome. I know this is a lot to take in, and in no way in any attempt to scare or give a diagnosis. It is solely a way to give you knowledge of EDS and kind of what I'm going through. It's important to raise awareness because there are many out there that have falsely been diagnosed with other conditions, when in fact it could fall under the rare condition of Ehlers-Danlos. I'd like you to share this video, help raise awareness, and, I know my experiences are nothing special. Countless families are living with Ehlers-Danlos and have nearly identical issues. The real blessing of social media, YouTube, and different things, blogging, is what we can learn from each other and support each other and make the lives of our kids and our families better. I deeply appreciate anyone who watches and reads and comments, and I love hearing about your experiences and thoughts. If you would like to know more about Ehlers-Danlos, there's lots of material that you can read through search engines, but the best thing is go right to the source at www.ednf.org. Lots of information, support sites, and, always, comment here and I can give you additional information that you can research also. And God bless, and have a nice time.